And it's a big day for Austin ISD families. Today is the first day of school for in-person learning, but it comes as cases and hospitalizations rising once again in Central Texas. Here to talk more about this is what ISD is doing also about to keep the COVID-19 at bay, keeping your kids safe, is the district's health director, Alexandra Copeland. Good morning. I appreciate your time. I know you're busy today. Austin ISD, I want to make sure I get this correctly, one of the several districts going against the governor's order, right? Making it a requirement the kids do have to wear a mask on district property. How hard of a decision was that for the district to come up to go against the governor?
Hi, good morning. Thank you for having me here. So as far as masks, we required masks last school year, and we know that it works. That was one of our safety measures that we had in place, and we know from the research and the science that mask works and it stops the spread. We did not see spread in our classrooms, and so we entered into stage 5 in Austin, Travis County, and we knew that we had to keep our kids safe and we had to keep them number one. So we will be requiring masks for all students, staff, and visitors that are on our campuses.
You talk about masks during the day, but what about lunchtime? They've got to take them off to eat. Will they be going to the cafeteria? How will lunch look now?
So lunch will look different depending on the campus that they're at. We really want to customize this to the campus and what their available resources are and what their layouts are. So the biggest thing is we're really going to be encouraging outdoor eating spaces, and that's good just for vitamin D and a lot of other things for the kids. And as far as in the cafeterias, we may have some kids that eat in the cafeterias that are split up into smaller groups, also with seating charts. We could have campuses that have kids eating in the classrooms, and so it's really going to be dependent, upon the campus, but we will have all of our other health and safety measures in place. So, hand sanitizer, everybody will have to use that before they go through the line. We'll have plexiglass there. Again, really making sure that kids stay in small groups and they are separated. And so, I know that, again, it's going to look different on every campus. So we're encouraging people to reach out to their campuses and ask how it's going to look at their campus.
Now, we don't want to think about having, positive cases on campus, but more than likely it's going to happen. What happens for moms and dads? How are they going to find out that there is in fact a positive case, and what happens from that point on?
Yeah, that's a really good question that we keep getting. So, one thing that I have been mentioning just throughout the last several weeks is that AISD has a public health team, a COVID response team that individually responds to every single case. And so we had these protocols in place last year that we're going to be following into this year. TEA came out and said that we don't have to notify families if we have a positive case, but Austin ISD, really wants to remain transparent with our families. So when we do have a positive case, we will have our campus positive case notification letters that go out to the campus. We will be updating our dashboard daily so families can go and look through that. But also we will still be doing contact tracing. And so, if we have a student or a staff member or anybody else that was deemed to be in close contact, we will make contact with them and they will receive a quarantine notice with instructions and support from us as a district.
So what can we do, last question here, to help support all the teachers, all the staffs, and our kids during this next school year that we just don't know how it's going to look?
Yeah, so the biggest thing that I have been telling people is, I think the thing that is most helpful is, we have these health and safety measures implemented on our campuses, but it's also so important that people also follow those health and safety measures off campus. And so, I've been saying the 4 biggest things that people can do is to get vaccinated if they are eligible to get vaccinated, to make sure that they are washing their hands frequently, to make sure that they wear a mask that covers their nose and their mouth, especially when they're around people, that are not not in their households, and then to also stay home if they're feeling sick. And so we have so many different supports and resources on our campuses. And so if somebody is feeling sick, we encourage them to contact their campus so we can provide that support and do contact tracing, but then also take advantage of our available resources. So we will still have, rapid testing in our health rooms for students and staff. And then we're going to be continuing our vaccine efforts for anybody that needs it and is eligible.